In a communique, well, the National Association of Resident Doctors insists its 3 weeks old strike will continue despite a court order directing them to return to work. In a communique issued at the end of an extraordinary National Executive Council meeting, the association accused the federal government of misinterpreting the court ruling and misinforming the public. They alleged that despite the express instructions given by the President of the Federal Republic of Nigeria to the Federal Ministry of Health to sidestep all technicalities in resolving the issues, not one item on the table has been settled. In its resolutions, the NEC demanded that an emergency meeting of the National Council on Health be convoked to discuss health emergencies and fashion out ways to universally resolve all the issues affecting the state health institutions in the country. Our Public Affairs Analyst, Victor Okhai, joins me now to discuss this. Good morning, Victor. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Let's get your perception of how government has been handling these matters. Despite the meetings which ended in a deadlock, the federal government dragged the association that's of resident doctors to the industrial court. And then there was a ruling that came which was said by the resident doctors to have been misinterpreted by the federal government and misinforming the public. So as a result of that, they are continuing with their strike. But then again, recent development says that the Governors Forum are looking to intervene in this matter. But then when you look at how we have handled this matter so far, seeing that we are in a pandemic and then there are outbreaks of all kinds of epidemic, I wonder, and then we also see the exodus that we're witnessing. How would you react to all of this?
Frankly, I was going to start with the exodus because I saw a picture. It was online just a couple of days ago. Abuja it was, I think, where they're recruiting for doctors in Saudi Arabia, and I was aghast. I mean, it's alarming. It's something that should scare us, as a matter of fact. Coming from the pandemic, this is something we should never allow. The pandemic taught us that the most important people to have, particularly at a time like this, are your health workers, because they are never really enough. And so you cannot afford to toy with them or treat them with kids' glove. What the Governors Forum is doing, I would just say, about time. They're not necessarily innocent themselves, because some of these problems start from some of these states. It's not necessarily the federal government, and then one state has problem with its doctors, and then other states go on strike as well to make a point. But I think that they should do this more responsibly now. We cannot allow this to continue. We're about to go, hopefully not, into a third wave. We were lucky the first time, we were lucky the second time. I don't know if we're going to be as lucky the third time, regardless of the vaccination, you know. So I think that the government should reprioritize and take health very seriously. And human capital is the most important asset. Medicines alone can't do it. Someone has to recommend, you know. And so the health workers, and it takes quite a lot of money and time to train. What we find out over the years is that we do all the training here, and then we export. Other countries just
come and take.
Mop them up.
Wondering, what is it that this country is seeing and that we are not seeing? Why is it so challenging for us to not see that?
It's a challenge of leadership, because, quite frankly, people have suggested that our leaders should not go abroad for treatment. Maybe the pandemic, I thought, would have taught them a lesson, but I don't know how that can be enforced. But that's perhaps the only thing that can make them see reason. Because the truth is, if anything happens to any of the elite, they're on the next plane abroad. They do their medicals abroad, and so they don't care about your doctors here. So for them, the doctors here are for the masses. Their own doctors are abroad, you know, for their families and for themselves. So that, I think, is where the problem is, and that's why they don't really care. They pay them peanuts, they treat them like they're nothing, and yet These people are prized possessions in other countries.
You think that if we come up, so how do we address this issue of, not allowing public office holders go outside of the country for perhaps second option, as people call it?
Everything rises and falls with leadership. To do that effectively, first, you know that the lawmakers,
right?
Yes, the lawmakers, that's within their purview. They're the only ones that can make that law. The executive can raise a bill as well, but that's the thing. Would they allow it? That's the problem. So what we need to do is consciously address the issue of our health system in the budgeting, in the education of our doctors, and in the remuneration. We have to be deliberate. If NMPC can be on a special salary scale, much higher than what doctors are earning, okay? If FIRS can be on a special scale, I don't see why doctors should not be earning more than, if you like, everyone else, in the civil service. We need to be deliberate about this. We need to treat them, the healthcare system entirely, not just doctors, of course, the nurses, the medical science laboratories, the pharmacists, and all of them. We need to treat them. No matter what you do, you can only do it because you have life. And the people responsible for this are the doctors. So we have to be deliberate. Everything rises and falls with leadership. We have to have a leadership that considers health a priority, education as well, because you need to be able to train the doctors as well as other professionals. So we need to continue to replace, if we can. I know that it's difficult to make health, education free, but if you make it a priority, you get more doctors. Okay, you get more nurses, you get more pharmacists, and the rest of them. So we need to be deliberate about it, but it just takes a leader who is compassionate, who can see this and make sure that we do that. But that's the only way. Now,
this issue, some would say that perhaps got to a climax, so to speak, in recent times, but that the exodus of medical professionals has been on for a while, and this issue of talking about a healthcare system, the state with which it is being in a bad shape, has been on for a while. True. Are you saying that the leadership of over how many years, talking about if we are trying to find how we got here,
yes,
is it that it began years ago, the leadership of years ago didn't see the need to address these matters?
Quite frankly, that's the truth. And the reason is simple. They have an alternative. If they can fly abroad, then they don't see any need. It's like the education system. These are the two most critical sectors of our economy: education and health. Of course, we might talk about agriculture and the rest of them, but education and health, very, very critical. And they both speak to human capital, because one maintains it and one prepares it, if you like. One trains.
Absolutely.
You understand what I'm saying? And they're the most critical. And so what happens is, because our leaders have access to free taxpayers' money to take care of their family, both in terms of education. Time was when people would come from abroad to our universities. Not anymore. Okay? Now we have to go abroad. So as long as they can send their children abroad, and as long as they can go for their health abroad, nothing matters anymore. Now people can fly freely. You can see that the man in charge of labor, who is supposed to be in charge of, apart from the health ministry, you always have a doctor there, of course, but the person who is in charge of negotiations is a medical doctor, but he wants to be a politician. You understand? It doesn't matter anymore that if he was on that side, he would see, but he doesn't see it anymore. Because
but these are people's lives involved. To what end will you be playing politics with people's lives?
You see, again, let me say this: it's hard, but if it's not, if you hear, like we have been so desensitized in this country, 50 people were killed in Baga, 30 were killed, or 20 were killed in Jos and all that. Right now, it's just statistics, unfortunately. Like they say, if it's not your relation, it's like a log of wood until it comes closer home. You know what I mean? In other countries, if there was a bomb blast in America right now and 5 people died, our president will be quick, or our leaders will be quick to send condolence messages to them, you know, and all that. But not so anymore in this country. And so for them, it doesn't matter anymore. We have been so desensitized, it does not matter anymore. So
if we do not act as quickly as possible, what do you think are the implications?
The implications are there. We have a population of 200 million, so it may seem like, okay, it's nothing. But the way it is, you see these doctors, the numbers that are going right now, we are not replacing these numbers. It takes at least 6 to 7 years to train one doctor, and it costs a lot of money to train every single doctor. I'm not talking about nurses, I'm not talking about pharmacists and the rest. And the way it is right now, there's nothing attractive in this country anymore in terms of, you know, the way, I would just want to focus on the health system and not even talk about the general state. The way they are treated by those who are supposed to represent them in the health ministry, the way they are treated by their colleague who is also a medical doctor in labor, and the way the conditions of service generally, you know, makes it very, very difficult. And when you consider the fact that you slave here, you do all that you do here, and your colleagues, maybe your juniors who live for other countries where there's great demand, where you'll be respected, you're going to be earning probably 20, 30 times what you're being paid here, and you'll be treated with far more respect than the way you're treated here. Frankly, I think everybody owes it to himself to be selfish, because the thing is, you look after yourself first before anybody else. And I think that's what has happened right now. For me, it's an existential issue right now. The doctors, and you're not going to blame them, the most important thing for them now is how they can survive, self-preservation. If it's better out there, let me go out there, you guys can take care of yourselves here. And I'm not going to sit down and talk to any doctor about being patriotic. I would love to. It's the right thing to do. But the guy has a family to take care of. He has bills to pay, landlords, children's school fees, and all of that. Are you going to say to him, when he's being pushed here and there, and he can be treated better elsewhere, he shouldn't go? Unfortunately, not the case.
Right. And that will be a fine place to leave the conversation. Public Affairs Analyst Victor Okhai, thank you for your time.
Thank you for having me.